Subscribe. Universal health care can help to address the current health disparities that exist in India, as it would ensure that everyone, regardless of their social status, has access to essential health services. About universal health coverage, care. The United Nations defines UHC as, everyone, everywhere should have access to the health services they need without risk of financial hardship. Sustainable Development Goals Target 3.8 also focuses on achieving universal health coverage. In the context of India, this includes health promotion, prevention, treatment, rehabilitation, and palliative care, without experiencing any financial hardship or risk of impoverishment. The evolution of universal health care. In 1977, the World Health Assembly endorsed the slogan, Health for All by 2000, implying universalization. Thus, nobody is denied this and everybody is eligible without being discriminated against on the basis of financial status, gender, race, place of residence, affordability to pay, or any other factors. India committed itself to this goal through its National Health Policy in 1983. India's initiatives for UHC. National Health Mission, NHM was launched by the Union Government in 2013 subsuming the National Rural Health Mission, 2005, and the National Urban Health Mission, 2013. Main components. Health system strengthening. Reproductive maternal neonatal child and adolescent health, RMNCH+A. Communicable and non-communicable diseases. NHM envisages achievement of universal access to equitable, affordable and quality healthcare services that are accountable and responsive to people's needs. Saksham Anganwadi and Poshan 2.0. Saksham Anganwadi and Poshan 2.0 is an integrated nutrition support program. It seeks to address the challenges of malnutrition in children, adolescent girls, pregnant women and lactating mothers through a strategic shift in nutrition content and delivery and by creation of a convergent ecosystem to develop and promote practices that nurture health, wellness and immunity. Components. Nutrition support for Poshan through Supplementary Nutrition Program, SNP. Early childhood care and education, 3 to 6 years, and early stimulation for 0 to 3 years. Anganwadi infrastructure including modern, upgraded Saksham Anganwadi, and Poshan Abhiyan aims to reduce stunting, undernutrition, anemia and reduce low birth weight by 2%, 3% and 2% per annum. National Food Security Act, NFSA. The Union Government provides food grains at low cost under the NFSA. The Act aims to ensure people's food and nutritional security by assuring access to enough high-quality food at reasonable prices. Advantages of universal health coverage in India. Improved access to health services. UHC would ensure that all Indians have access to necessary healthcare services, including preventive care, treatment, and rehabilitation, regardless of their financial status or geographic location. Better health outcomes. Access to healthcare services will improve health outcomes and reduce mortality rates by diagnosing and treating illnesses and diseases at an earlier stage. Reduced financial burden. UHC would protect individuals and families from catastrophic healthcare expenses, reducing the financial burden on households and preventing them from falling into poverty due to healthcare costs. Increased government accountability. UHC would increase government accountability in healthcare, as the government would be responsible for ensuring that all citizens have access to essential health services. Increased productivity. Improved health outcomes would lead to increased productivity and economic growth as a healthy workforce is more productive. Challenges in implementing UHC in India. Inequitable access to health insurance. The lowest coverage of health insurance is among households with the lowest wealth quintile and underprivileged sections, indicating a lack of equitable access to health insurance. The NFHS 5 results paint a different picture for India, where insurance coverage is lowest, 36.1%, among households with the lowest wealth quintile. Lack of financial protection. Despite the existence of schemes like Janani Shishu Suraksha Karyakram, the average out-of-pocket expenditure per delivery in public health facilities is still high, particularly in urban areas. The latest report of NFHS revealed that the average out-of-pocket expenditure per delivery in a public health facility is Rs. 2,916, which in the case of urban and rural stands at Rs. 3,385 and 2,770 rupees. Inclusion and exclusion errors in health insurance policies. Recent studies have shown that like earlier health insurance policies, the Pradhan Mantri Jan Arogya Yojana (PMJAY) is also not free from inclusion and exclusion errors, which could lead to the inclusion of ineligible households and exclusion of eligible households. Availability of services. Although 56% of empaneled hospitals under the PMJAY are in the public sector, 40% are in the private for-profit sector, indicating that the availability of services may be concentrated in areas with previous experience implementing publicly funded health insurance schemes. Inadequate infrastructure. In many low and middle-income countries, the lack of proper infrastructure is a significant challenge to achieving UHC. This includes inadequate health facilities, inadequate equipment, and inadequate medical supplies. There is a shortfall of 79.5% of specialists at the community health centers, CHCs, as compared to the requirement. Poor health education. Lack of education and awareness regarding healthy lifestyles and preventive health measures can lead to an increase in preventable illnesses and conditions.